Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello and welcome to this week's episode of the podcast. If you are a man or there is a man in your life, then listen up because this podcast is for you. Today we are tackling the topic of men's injectable treatments for aesthetic purposes. There are tons of treatments that can be done for a man or for a woman, of course. But today I'm really going to focus on the things that require injectables, those that are done by a physician or a nurse injector, and in particular things that I do in my practice. So this is going to include things like neuromodulators, it's going to include things like fillers, it's going to include things like platelet-rich plasma or PRP, and we're going to get into all of that. Before I get into those, I do want to again emphasize that this is just a little sampling of the things that can be done for a man. Just like women will often get facials, women will often have various types of laser treatments to the face to work on skin texture and coloring and sun damage. These, of course, are available for men as well. And we do offer these at Anti-Aging Medical and Laser Clinic in Vancouver. But again, today I want to focus on the injectable treatments that we can perform. And what we'll do is we'll basically start at the head and work our way down. Yes, we are going to work our way down. And I may be even sharing some treatment ideas that you did not know exist. And we'll get to those as the podcast goes on. Let's start at the top. First of all, a very common cosmetic treatment for men is with regards to hair restoration. As you know, male pattern baldness is extremely common, and this is something that men can be quite self-conscious about. Since I just mentioned that, I do want to just pause for a moment and say that these treatments, all the treatments that I'm mentioning today, all have to do with the concept of health esteem, how one feels about themselves. And this applies to women as well, of course. The reason that we go about and we get aesthetic treatments is because we want to feel better about ourselves. We want to have increased confidence. And this is something that I am very big on, and that is the idea of helping to sculpt someone's confidence. Because when they feel better about themselves, they can live a more fulfilling life. And so that is very important to me. If you think about it, we are very much aesthetic beings, whether we want to admit it or not. Every time you choose to put on a piece of clothing, it's a statement. You are presenting yourself to the world. Every time you get a haircut, why do you get a haircut? Really ask yourself that. It's because typically you want to look better for yourself and for others. And why would someone wear makeup? Why would someone dye their hair? Why would someone get a neuromodulator treatment? Why would someone get filler treatment? It's all a continuum. And so I think that's really important to point out here. So with that being said, that little aside, let's go back to the idea of hair restoration. There are a number of things that can be done. There are various types of medications or topicals that can be used. But again, I want to focus on the injectables. And one of the things that we can do for hair restoration is PRP, platelet-rich plasma. If you don't know what platelet-rich plasma is, it is a treatment where we take a blood sample of your own blood. We then spin that down in a centrifuge. That then separates the blood into its components. The red blood cells, the heavier parts of the blood, settle at the bottom. And at the top, we have the plasma, or the more liquid part of the blood. And within that plasma are the platelets. What's really cool about the platelets is that they contain many different types of growth factors. And so then what we can do is we can essentially siphon off the platelet-rich plasma, and then we can inject that into various places in the body to help, depending on where we're injecting it, in various ways. In the case of hair, we can inject small amounts all over the scalp, but focusing on areas where there is decreased hair density, and this can help to promote hair growth in these areas. This is typically a treatment that needs to be done a number of times, but it is very effective, and this is one of the treatments that is extremely popular with men to enable them to continue to have full, lush, healthy hair on top of their head. So that's the first treatment that I want to mention, and I do provide this treatment at Anti-Aging. So if that's something that interests you, of course, feel free to reach out. As we move our way down, PRP can also be used on the skin, And this is a treatment that can be used to help give a nice glow to the skin, to help encourage good growth and collagen in the skin. And that is something that I personally do not do, but I have technicians that do that at the clinic as well. Now, the next injectable treatment that I do as we move our way down the body is the idea of neuromodulators for the face. So neuromodulators are the generic fancy term for the brands that I'm sure you've heard of: Botox, Dysport, Xeomin, and Nuceiva. And these work by relaxing muscles in the face. And just like these treatments are very popular with women, they are equally as effective for men. Sometimes men do need larger doses simply because the muscles are a little bit larger in the face, but we can use these treatments to treat frown lines, forehead lines, crow's feet, and essentially any other type of wrinkle in the face that can be treated with a neuromodulator for a woman. There's essentially no difference other than the dosing. And this is very important. If you are a man and you're considering getting these treatments, then make sure that you are seeing somebody who has some expertise with treating men, who understands the subtle differences in the dosing. They are extremely effective. They do tend to wear off, as all neuromodulators do, after about 3 months or so. And this is typical with these treatments. And then this is something that can be repeated as needed. The other thing that can be done in the face is the use of dermal fillers. These typically are a hyaluronic acid type of filler, although there are other types as well. And these can be used to contour and shape the face and fill areas that start to become a little bit deficient as we start to age and we lose our fat pads. So, some examples of some of the more popular filler treatments for men would include along the jawline to give that nice, strong, sharp definition of the jaw. This can be extremely popular. And then as you carry that forward, you can then go into the chin and create a nice, strong, contoured chin. There are some differences in the way that fillers should be done with men and women because the proportions and the measurements of the face are different. So again, it's very important to have treatments done by somebody who has some expertise with the male appearance and what makes a masculine type of appearance. So that's a little bit about the neuromodulators and the fillers. Now, as I mentioned, we are going to work our way down the body. And when we get down to just below the belt, then we get into the genital region. And this may be an area that you are not familiar with, that we can do a number of treatments, but it's also a very, very important area. It has often been said the way that a woman may choose to have a breast augmentation done for her own health esteem or have her lips filled for her own health esteem, you can do the same thing with the male genitalia, with the penis. And I would like to talk a little bit about the penile filler, penile augmentation, as well as penile neuromodulator treatments and what they are used for. Maybe we'll start with the neuromodulator treatments simply because I think it's a little bit more simple to explain. When it comes to neuromodulators, again, neuromodulators such as Botox, Xeomin, Nuceiva, and Dysport, these function by relaxing the muscles. And in the case of a man, some men may experience what is often casually referred to as shrinkage. This actually is a real phenomenon, and it has a name. When I say shrinkage, it is the appearance of the penis getting smaller and retracting up into the body, because it is a fact that the penis, while a portion of it is external, some of it is also internal. And when you have a hyperactive penile retraction reflex, or shrinkage, this can cause the penis to retract into the body. Certain conditions exacerbate this, but by relaxing the muscle that controls that reflex, you can actually allow the penis to hang lower and not have the same amount of retraction or shrinkage that would otherwise be present. And this can go a long way to helping a man feel more confident and feel better about themselves. So there's a real value in looking into this as a treatment. This treatment is done very simply. It is a number of injections in and around the penis. And just like other neuromodulator treatments, it can be repeated as needed. Results are extremely effective. particularly for those that do have a fair bit of this retraction reflex, you can see a significant increase in the length of the penis when it is in a flaccid state. Now, you can also use a similar type of treatment around the scrotum. This can allow the scrotum to hang lower and have less of that reflex that forces it to contract and have the scrotum sit higher up on the body. Men have said that when they have this treatment done, they feel more confident, they feel better about themselves, and in fact, partners enjoy the appearance of this as well. And so this is another treatment that can be done using the neuromodulators as well. Now, another treatment that can be done to improve the length of the penis as well as the blood flow and help with erectile dysfunction is a PRP treatment in the penis, platelet-rich plasma. Just as I described that for the hair, we can do a similar thing for erectile dysfunction and to help the penis grow in length. Again, a blood sample is taken from the person, spun down, the platelet-rich plasma is siphoned off the top, and that is injected into the penis in various places. And over time, with various other techniques in conjunction, we can see an increase in length of the penis as well as an improvement in the erectile dysfunction. This can be extremely effective as well. Finally, the last treatment that I want to mention with regards to male genitals is dermal filler for the penis. Dermal filler for the penis specifically works on the girth of the penis or the diameter of the penis. Once again, there are a number of men that feel that they would like to have some extra girth to the penis for their own self-confidence and for the enjoyment of their partners, and this is something that can definitely be done. There are certain types of filler that are used specifically for this, and the results are significant. When we do this treatment, we provide a block to the penis so that we make this as painless as possible. Once we have the block, the penis is essentially numb so that we can do the filler without any discomfort at all. We then inject the filler, the specific type of filler, along the shaft of the penis. We can also inject some filler into the head of the penis or the glands of the penis. And these treatments, again, are very effective. You have noticeable differences, and this can have a significant impact on the health esteem of a man. In my mind, the biggest reason to do it is because it increases the confidence of the person that is having the procedure done. I'm really pleased to let you know that I am certified and have had specific specialized training in male enhancement treatments. And again, if you are a man that is considering this, or you know somebody in your life that may be interested in these types of treatments, then this is a treatment that is very effective and can have a significant impact on a person's confidence and their outlook on life. So, I plan to do some more episodes specifically on these treatments, answering more questions about these treatments, and look for those coming in the near future. As always, thank you for tuning in today. It's a pleasure to chat with you. And again, if you're interested in any of these treatments, feel free to reach out, antiagingvancouver.com, or my own website or Instagram, drterifisher.com. I look forward to speaking with you very soon. Until next time, talk to you then.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.